Hi, my name is Jeffery and I'm the non-clinical training manager here at University Hospitals Dorset. I'm here today to talk to you about the training and education opportunities here at the Trust and how you may be able to take advantage of those on your own journey with us, should you choose to join the team. Now, if you can go to the next slide. Firstly, I want to go through a couple of facts with you, because did you know the NHS is actually the 5th largest employer in the world, which is massive. And on top of that, it's also the largest employer in Europe. So it's a big organisation, and it covers a lot of trusts across the land. Yet, despite that, it still feels like a small community. And in that small community, like any other small community, we have roles and opportunities in all different areas, because we have catering, we have car parking facilities, we need people to look after our IT systems. We also need people to look after our buildings and maintenance. So we have our facilities and maintenance team. We've got teachers, we've got carers, we've got plenty of other roles which are both clinical and also non-clinical, that some people, including myself, before I joined, wouldn't have even have heard of. So there are hundreds of opportunities across the NHS Trust. And what I want to talk you through is just how you can get involved with those, but also the kind of education and training that is available to help you on that journey. So if you can go to the next slide. Because the first thing I want to take you through is our healthcare support workers. Now, our healthcare support workers are some of the beating heart of the team. They really do keep the trust running, because our healthcare support workers works across a variety of settings. And they can go all the way from mental health through to children's services. Now, a healthcare support worker in that job role is for someone with limited or possibly even no hospital experience. And what the programme looks to do is to train that person to work in a hospital and be able to perform basic tasks to help our teams do what they need to do. When you're ready, you're able to progress to more advanced procedures such as cannulation, venipuncture, and the opportunities to progress are honestly endless. You can choose to specialise in a particular setting, or you can train to qualify as a healthcare professional, such as a nurse or a midwife. And it is a very hands-on role. So 1 minute you could be taking blood, the next you could be lending an ear to an anxious patient. Who knows what every day is going to hold? But it's one of the most rewarding roles within the trust. And your day-to-day will vary depending on where you are. So it could be absolutely anything you're doing, from helping patients moving around to making patients feel comfortable. It could be performing basic health checks and monitoring patients. There is absolutely loads to do. And what is great about the healthcare support worker role is it's a fully supported role. So I'll talk about inductions in a little bit. But as part of being a healthcare support worker, you'll go through a week-long intensive training course to upskill you enough to work with us here for all the time that you are a healthcare support worker. And after that week's training, you'll be under the supervision of a qualified healthcare professional. We also offer callback days to make sure that support goes beyond just that 1 week of training. And there are tons of opportunities to help you along in your career, should you choose to take this path. Now, if you can go to the next slide for me. The next opportunity into the trust from a training perspective would be through apprenticeships. Now, apprenticeships exist outside the NHS. They exist all across the country, and they're a fantastic way to upskill yourself and to learn whilst also earning in a full-time role or possibly a part-time role. It's not just on the wards that we offer apprenticeships. So whether you're interested in a career in customer service, administration, team leading, clinical healthcare, or other trades, we have possibly got an apprenticeship for it. So if you're anywhere over the age of 16, then you can apply for an apprenticeship and you can come onto the apprenticeship scheme, and that is subject to, and you pay the national minimum wage for apprentices. Apprenticeships take between 1 and 5 years to complete, depending on the course itself. If you're over the age of 16, anyone can do one. They differ based on courses, but you're likely to spend 4 days with us on work placement and then 1 day in a training centre or a college to supplement your learning. So you've got that real blend of on-the-job practical learning of the theory that you're going through, but equally you've got that time put aside to really make sure you can understand all the skills that you need and all the knowledge that you need in order to complete the qualification. You'll also gain a competence qualification, and that could be that will be based on what you can do in the workplace, and then also we offer support with English and Maths should that be something that you also need support with. NHS apprenticeships generally sit at 4 levels. So our entry apprenticeships will either sit at level 2 or level 3. So that will be at sort of GCSE level or A level. And that will be our advanced apprenticeships. And then once you're with us in the trust, there's still opportunities to progress and there's still opportunities to undertake apprenticeships. And they'll be either higher apprenticeships level at foundation degree or above, or there could even be degree apprenticeships. So that's equivalent to a full bachelor's or even master's degree. So there are endless opportunities with apprenticeships. So if you go to the next slide, please. Because once you're with us, the support doesn't stop there. So depending on your job role and depending on what you're doing with us here at the Trust, you'll go through an induction. Now, we have multiple inductions supporting all different types of staff. And it will be tailored to your role. So it'll be the perfect time for us to get to know a bit about you, your aspirations, and what you want to achieve whilst you're with us. But also it's a great time for you to get to know us, our vision, our values, our ambitions, and the structure of where it is that you'll be working. We offer tailored support for groups such as I said, our healthcare support workers I mentioned earlier on, groups such as our newly qualified nurses, those nurses that are bringing valuable experience by joining us from overseas. We've also got a tailored support for those that are returning to nursing after some time out, and then also for our junior doctors as well. So there is plenty of tailored support on offer. You've also got access to world-class and leading IT systems and leading e-learning platforms. So we have an e-learning platform here at UHD called the BEAT VLE, so Virtual Learning Environment, and that's where you can constantly update your skills and knowledge. You've also got use of our state-of-the-art simulation suite. So for those clinical skills that you need to physically practice, we have a simulation suite for that. We also support our clinical educators to help you develop those practice-based skills. And then also outside of that, whether it be personal effectiveness, resilience, leadership, whatever the topic may be, our organisational development team have a whole range of courses geared towards personal development and those opportunities. So if you can go to the final slide for me. Thank you very much for listening. Like I said, my name is Tom. And if there's any questions, please do let us know. But for now, I'm going to hand you back over to Danny, and he will now answer any questions you may have. But if you want any more information about the education and training team here at UHD, don't hesitate to get in touch with the recruitment team.